Hi, Wisconsin. Governor Tony Evers here.
And I'm Lieutenant Governor Mandela Barnes.
We wanted to take a moment today to thank you for wearing a face covering or a mask whenever you are out and about.
Your good work can save lives. As we know, face coverings and masks are effective tools to stop the spread of COVID-19.
That's right. And we wanted to share some tips to make wearing your mask even better. First of all, wear your mask whenever you are indoors in a space that is not your own home.
Second, wear a mask anytime you're around others who you don't share a home or a living unit with.
Next, always wash your hands before and after putting on or taking off your mask.
And remember, not to touch it or move it around without washing your hands.
And finally, a mask or face covering is not a substitute for physical distancing. Please continue to maintain 6 feet of distance between you and anyone who is not a member of your household.
These steps are critical to our efforts to box in this virus and keep Wisconsinites safe. So mask up, Wisconsin.
And let's get through this together.
Taking care of your health is more important than ever. So if you have questions about health insurance, there are people who can help. They can explain your options and see what financial help is available. In Wisconsin, 8 out of 10 people who enrolled in the healthcare.gov plan last year qualified for financial assistance to lower their monthly payment. So to find an insurance expert who can provide free one-on-one assistance, go to wiscover.com or simply call 211. The deadline to sign up for coverage is December 15th, so there's no need to wait. Visit wiscover.com or call 211 today.
Open enrollment is here, and making sure that you and your family have health care coverage is more important than ever. If you need health insurance, there are people who can answer your questions and help you sign up for coverage. Visit wiscovered.com or call the 211 helpline to find an insurance expert who will help you one-on-one for free. The deadline to sign up is December 15th, so don't wait. Visit wiscovered.com or call 211 today, because now more than ever, your health care matters.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please remain muted until it's time to ask your question. If you're on the phone and are able to do so, please use *6 to mute and unmute. Joining us for today's briefing are Governor Tony Evers and DHS Secretary-designee Andrea Palm. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases, and Ryan Nilsestun, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks for joining us again this afternoon. Yesterday, we saw the highest reported daily death toll, with 92 Wisconsinites losing the battle against COVID-19. That's 92 of our fellow Wisconsinites, 92 people who were somebody's best friend, mom, dad, grandparent, coworker, or neighbor, brother or sister, and somebody who meant a whole lot to somebody else. It's 92. Our hearts and deepest condolences are with their loved ones and their communities. One death is too many, and unfortunately, we know these individuals will not be the last. I warned last week that the Institute for Health Metrics and Evaluation estimates that if we continue on the path we're on, Wisconsin could see 5,000 deaths by the end of this calendar year. And the gap between now and then, today's numbers and those numbers continue to shrink, and quickly. This isn't something happening someplace else to somebody else. It's our friends, our neighbors, and our loved ones who are getting sick. Nearly 2 months ago now, we issued our current public health emergency on September 22nd. Back then, our 7-day average of daily new positive cases was around 1,800. We had about 104,000 confirmed COVID-19 cases, and we'd lost 1,251 Wisconsinites. Things have worsened quickly since then. As of yesterday, we've now more than tripled our 7-day average, averaging more than 6,400 new positive cases per day. The number of confirmed COVID-19 cases has tripled. We now have more than 323,000 positive cases in Wisconsin. We've more than doubled the number of Wisconsinites we've lost. Since I issued my last public health emergency, we've lost another more than 1,500 Wisconsinites, bringing our total number of COVID-19 deaths to 2,741. Well, our current public health emergency expires this Saturday, November 21st. But it's clear, based on where we're headed, we cannot afford to stop or have a gap in some of the only mitigation efforts we still have in place. So today, I'm announcing I'll be declaring a new state of emergency this week and extending our public health emergency until January of next year. We will also be reissuing emergency order number 1, requiring face coverings in public places. As many of you also know, our current public health emergency and our face coverings order are being challenged in the Wisconsin Supreme Court. Republicans in the legislature support this effort. That's why today I'm also once again calling on Republicans to withdraw their support for this lawsuit and to publicly support our new public health emergency and face coverings order. It's time, folks. We do not get any do-overs here. Enough games. We need you to join the cause, and we need you to start today. We've got a long road ahead of us, Wisconsin, but we know there's light at the end of the tunnel. We've heard promising reports of vaccines on the horizon in the new year, but we need to buckle down and get through this together until then. But as we look forward to that vaccine, we also know that the new year brings the expiration of our federal CARES funding. To date, we've invested nearly $2 billion of federal CARES funding across the state in emergency response and public health measures, as well as economic support initiatives for Wisconsin residences, businesses, and communities. We need robust federal support to get us through, not only to aid our state response to the virus, but to help families put food on the table, help workers make rent, and help employers keep their doors open and lights on. I will continue to call on our federal partners to pass meaningful, comprehensive support for our state, and I hope Wisconsinites will join me and make calls to their federal representatives as well. As always, Wisconsin, please stay home, Wear a mask if you have to go out, but otherwise stay home. Call it what you want, flattening the curve, stopping the spread, staying safer at home. I'm going to call it what it is. It's about saving lives. With that, I will hand things over to Secretary Designee Andrea Palm for her update. Andrea, it's all yours.
Thanks, Governor. Good afternoon, everyone, and thank you for joining us. Thank you, Governor Evers, for taking action to protect the safety of Wisconsinites by extending the public health emergency and reissuing the face covering order. Each time we hold a briefing like this one, I give an update on the numbers, the increase in cases, and COVID-19 deaths. I'll do that again today, but I'm going to start first by focusing on the consequences of these numbers. Since our surge in cases started, we've been saying it will get worse before it gets better. And you can see it happening as the strain on local public health and our hospitals grows. And a strained hospital system puts everyone at risk, whether or not you have COVID-19. Hospital staff are out sick, unable to come to work because they have tested positive for COVID-19 or because they are in quarantine. 1/3 of Wisconsin hospitals are reporting a current critical staffing shortage. 41% expect a critical staffing shortage within a week. Every region in our state has multiple hospitals that have activated their surge plans. In 2 regions, every single hospital in that region has activated their surge plan. Some have surge spaces and beds set aside, but they are going unused because there's no one available to staff them. Hospital systems are delaying non-emergency procedures. We have a children's hospital accepting adult patients. We are filling our intensive care units. Over the past week, hospitals have reported 9 of our ICUs at 100% capacity. There are 0 ICU beds available in one region of our state and 9 ICU beds in another. The availability that does not exist is changing by the minute as hospitals manage this crisis. This is not how it's supposed to be. Our frontline healthcare workers are doing heroic work, and we are so grateful for their dedication to the health of their communities. They're working extra shifts in overcapacity hospitals and ICUs that are stretched to the breaking point. They are caring for patients with complex needs, and they are saving lives, but they are also seeing intense loss of life. But this is an emergency we cannot solve through healthcare workers and our hospital system. It is up to each of us to solve it by taking action to stop the spread in the first place. We owe it to these frontline healthcare workers to stay home and prevent further transmission of this virus. We are adding 7,989 new cases today, bringing our total COVID-19 cases to 331,837. Our 7-day average of new cases is 6,563. It was 2,839 1 month ago. 2 months ago, the 7-day average was 1,575 cases. Since yesterday, 52 more Wisconsinites have lost their lives from COVID-19, which brings our total deaths here in Wisconsin to 2,793. As we mourn the loss of these friends and family members, we must recommit to doing all that we can to prevent transmission and save lives. As scary as this picture is, it is going to keep getting worse before it gets better. And it is only going to get better if we take action to make it better. Please stay home. Do not gather for holiday celebrations. It is not worth the risk. When you have to go out for the essentials, wear a mask, physically distance. Remember to wash your hands. We all must do our part to stop the spread. Thank you.
Thank you, and we'll now take your questions. A reminder to maintain audio quality. Please keep phones on mute until it's time to ask your question. And we'll begin this afternoon with Jonathan Neiser from NBC 26. Jonathan?
Yeah, thanks for taking this question today. According to WEAC, recently surveyed their members, and 90% of them said the state should create criteria for all schools to follow as far as if they should be virtual or do anything in person. What is the state? How does the state respond?
Well, we just received that letter a few days ago, and as you may have seen, the letter is long and lengthy and brings up a lot of issues in addition to gating criteria. So we're looking at that, but I will continue to say this, and that school boards across the state and administrators and teachers are making sure that they're doing their best, let's put it that way. And when we're seeing school closures, we're seeing schools that are frankly working well. And so it is a difficult thing for us to sit here and talk about it being a one answer to 420 some school districts. But we're looking at what the letter talked about. There's a lot of things in there besides gating criteria, and we'll be responding to them in the near future.
Thank you, Jonathan. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. I was just curious if you might be able to speak a little to this. Obviously, the mask mandate has been in place since this summer. We continue to see cases rise. Is there any other component to this or any other sort of efforts that might be able to be paired with this mask mandate that might increase the effectiveness that's being considered? Thank you.
Well, I'll just talk broadly. I mean, certainly everybody in the state that listens to these broadcasts and have been following the media understand that my ability to order things and have actually orders be efficiently monitored and enforced are exceedingly difficult. And so that's why we talk significantly about people staying safer at home. We know that worked in the past, and whatever we can do to convince people to stay safer at home and make those trips outside of their homes as infrequent as possible, I think that's where we're at this point in time.
I would say more broadly, Mitchell, that we know masks work. The science is clear about that, and there has even been more recent information out of the CDC that it doesn't just protect the other folks; it protects the wearer of the mask as well, which is something that was maybe a little less clear when we first started talking about wearing masks, right? It was, my mask protects you, your mask protects me. Well, it turns out it also protects me. So that is some additional information about the effectiveness of masks that I think is important for the public to understand. I think Dr. Westergaard may want to say more about the data on this, but I think compliance with mask wearing, the more people who wear masks, the more effective it is. And so I think messaging, clear and consistent messaging from all leaders is an important piece of how we help improve compliance with mask wearing, how we help improve the effectiveness of it. But Dr. Westergaard, I don't know if you want to say more about the data on this.
Well, I think the effectiveness is, the models assume that 80 to 90% is needed for it to have an impact on the epidemic. The additional protection that we need beyond masks is staying home, and that's where we're at. It needs to be complete, absolute, everyone, statewide, stay home. That's in addition to masks when you need to be out. We're at a really, really difficult spot, and that's the strategy. It calls for widespread staying at home.
Thank you, Mitchell. Now to Katrina Nickel from Fox 11 in Green Bay. Katrina?
Hi there. So my question is about the bill that was released yesterday and a little bit of response from Speaker Voss's press briefing. So Voss was critical of Governor Evers wanting to use state money before federal money to support these bills. So my question is, why did you choose to use more state money than federal funding for the bills? And what is your response to his criticism?
Well, it's pretty simple. We chose state money because the federal money ends on the 31st, and we have expended almost all the money that we did receive from the federal government on contact tracing and testing and making sure that we provide resources for our farmers and small businesses across the state and other areas that are struggling mightily economically. So the reason we chose state money is we can't print money here in Wisconsin, and so it has to come from someplace if the federal government doesn't step up. We would certainly spend that federal money first if indeed the federal government provided us with the resources that we need to keep people safe in the state of Wisconsin. So that's why we're encouraging people all across the state to make sure they reach out to their state representatives to get a stimulus bill that helps states maneuver through this pandemic. It's a national issue. It's not just Wisconsin. So that's why we put the state money in there. Clearly, if federal money comes, we'd reimburse the state for their contribution.
Thank you, Katrina. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. Governor Evers, could you specify when you plan to issue this new declaration indoor mask mandate? Is that going to be today, tomorrow, Friday? And are you looking at any other types of orders that could go underneath this new emergency declaration, such as the ban on evictions that was implemented earlier this year? Thank you.
The order will be released tomorrow or the next day at the latest, I would say. And the other order that will be connected to that will be face coverings. We believe the order would last until mid-January. We don't have any intentions of adding any other orders to that at this time because, frankly, the Supreme Court and the Republicans have taken most of those, the authority for most of those things to be ordered again. We do have in our package that we shared with the legislative leaders yesterday, or the day before, the eviction protections that were in place earlier, and we're hoping the legislature will come in and pass that bill along with others.
Thank you, Sean. Now to Victor Huckable from CBS 58 in Milwaukee. Victor?
Hello, good afternoon. Thank you again for taking this call. Governor, what is your reaction to, I spoke to some Republicans and, while Assembly Speaker Robin Vos says his hopeful timeline of passing a bill would be in December, some say that it might not be until January when that new session begins for something to be passed and be considered. What is your concern about that sort of timeline?
I think it's a bad timeline. They haven't been in for a long time. I do believe that the speaker had indicated that he had some legislation that he's willing to bring forward. I didn't hear anything about that yesterday. But at the end of the day, 2 years ago, they made it back into December to do a lame duck session. I see no reasons why we can't do it to save lives here in Wisconsin.
Thank you, Victor. Now to Eric Gunn from Wisconsin Examiner. Eric? Eric Gunn? Okay, we'll have to move on then to Rob Sussman from WTAQ Radio in Green Bay. Rob?
Hi, thanks for doing this call. My question is in regards to, is for Governor Evers. As I understand it, the legislative Republicans and yourself have yet to come to any sort of agreement, and in fact, the President of the Senate had specifically mentioned that he does not agree with some of the proposals that you've lined out. Have there been any discussions between you and Assembly Republicans in regards to maybe finding some middle ground here and figuring out, what can be done going forward in regards to coronavirus relief? Thank you.
Yeah, love to meet. We have met, our staffs have met with both leaders, and hopefully we'll meet in the near future to see if there is any willingness to find. I mean, a lot of these things that we've proposed, frankly, were passed by the legislature at the beginning of the pandemic. They've just expired. And so we're hopeful that since they passed many of them once, that they'll do it again. So yeah, we can always move my calendar around whenever they have the willingness to meet.
Thank you, Rob. Now to Katie Anderson from WBAY-TV in Green Bay. Katie?
Hi, thanks for taking my question. Andrea Palm was talking about just the shortage of healthcare workers, and I'm wondering if the Wisconsin Emergency Assistant Volunteer Registry is being utilized. How many volunteers have you gotten from that for hospitals, clinics, nursing homes, and obviously, is there a need for more?
Yeah, so Weaver, the thing that you spelled out, which I can never remember all the words for, is our volunteer registry that folks, clinicians from across the state can enroll in, sign up for, and be called upon in situations where we need healthcare workers to surge to help with staffing shortages. I think what we have, and we have been utilizing it throughout this pandemic for sure. I think one of the things we have realized is that it is a volunteer registry. It is folks who generally have a day or a couple of days or 3 days next month, or it really is a different kind of worker that is signing up for that registry than the situation we're in now, which is chronic staffing shortages that require a longer commitment than a day or 2 or 3. And so we, while we continue to look to Weaver to help us, we have also recognized that we need to bring other solutions to the table to help us with these staffing shortages, including the regulatory flexibilities we've put in place, the staffing contracts that we have, and the additional staffing agencies we're bringing to bear to help hospitals and nursing homes find staff outside of the state of Wisconsin, because obviously we are utilizing our staff pretty fully here within the state. We also are anticipating, like many other things in this pandemic, whether it's reagent or other testing supplies or PPE, that as states around the country see surges like we are seeing, that we will be in competition for clinicians across the country. And so we are doing everything we can now as it relates to staffing contracts and other things to make sure that we can have access to the kind of staff that we will need going into the winter. But I do anticipate that this is going to be an issue, again, not dissimilar to the kind of competition we have seen for other scarce resources during this pandemic. And what that really speaks to is the work we have to do to avoid getting to that place. We have got to stay home. We've got to wear masks. We have got to do the work together to stop the spread so that we are not in a place where we can't get our hands on enough healthcare workers to serve the folks who need hospitalization in the state of Wisconsin.
Thank you, Katie. Now to Lane Kimball from News 3 Now in Madison. Lane? And a reminder, *6 to unmute your phone. Lane Kimball. Moving on then to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hi, my question is, the governor last week mentioned that a new study shows, I believe it was 1 in 5 people diagnosed with COVID are also later being diagnosed with a mental illness. And on top of that, we already know that there have been increased rates of depression and anxiety just surrounding stress from the pandemic. And, each week we talk about hospitals reaching capacity, but is there also concern that the mental health care system could reach capacity? And if so, what would the implications be of that? Thank you.
It's a great question. I think, one of the things that we rely on more heavily in the mental health system is community-based mental health, and we have certainly seen an increase in the use of behavioral health telehealth services, and it is, we worked very closely with the legislature and others on that bill the end of last session, and we're able to implement it really rapidly so that we were able to maximize the opportunities for telehealth, including in behavioral health, to try to make sure that folks had access that they needed to the kind of mental health, behavioral health supports, addiction services that they might need in a pandemic. But we certainly are continue to be concerned about that. We recognize that whether it's residential treatment for addictions or other inpatient mental health services, that social distancing and trying to maintain safe spaces limits the capacity of some of those providers as well. And so we do need to make sure that we've got those assets in play, and we recognize that the increasing isolation and anxiety around this pandemic has certainly caused an increase in need for services across the state of Wisconsin and around the country. We've surged a number of additional hotlines and warm lines and peer support lines through grants and through partnerships with our federal partners, and we will continue to look for ways to make mental health services as accessible as possible during the pandemic. It is why we launched Resilient Wisconsin, which is an online tool for folks, but we are needing to be creative as we continue to move through this pandemic, recognizing that it is a critical set of community supports that we need to make sure we're making accessible to people in the state.
Thank you, Madeline. Now to Adam Rogan from the Journal-Times in Racine. Adam?
Probably a question for the General Counsel of the Governor. Are you guys expecting a legal challenge to this new emergency order? And if so, how do you plan to fight it? Thank you.
Well, I think this is Ryan Nelson. I think every time we've issued an order, there's been folks who have tried to litigate it against it. And we had oral arguments earlier this week in a case that addresses the governor's ability to issue public health emergencies. I think that will provide clarity on the path forward rather than a new lawsuit.
Thank you, Adam. Now to Danny Maxwell from WKOW-TV in Madison. Danny.
Hi, I apologize if this question was already asked as I just kind of hopped on, but I was wondering about the field hospital. And, our hospitals here and others across the state are obviously overwhelmed, but we're not seeing the numbers at the field hospital. They're pretty small comparatively, and so I'm just wondering if people aren't wanting to go to that field hospital and if there's any indication why.
Yeah, thanks, Danny. So our census today is 22, but I think it's important to remember too that we, as people are being admitted, people are also being discharged, and so we have served over 70 folks at the alternate care facility since it opened I lose track of time, whenever it opened, And as you've heard Deb Standridge talk about when she's joined us on these calls before, she spends a lot of her time in conversations with hospitals about the needs of patients, the potential of transferring patients, the eligibility around those transfers, the ways we can continue to work together to make sure hospitals around the state have ready access to the alternate care facility as a backup to the work that they're doing in communities. It obviously is ultimately a patient has the final decision-making about the transfer. Those conversations are happening at the bedside before the engagement of the alternate care facility. So I don't specifically, nor would Deb necessarily have visibility on those conversations because they're happening in hospitals and communities around the state. But it speaks more broadly to the things we've been talking about here today and previously, and that is the alternate care facility was our ultimate insurance policy. It was our backup plan, and we would prefer that no patients need to be transferred to the alternate care facility, but that our hospitals have the capacity and the staffing that they need to serve folks in their communities. That's the way this is supposed to work, and we need to get back to a place where that is how it is working, and that means we need to stay home, and we need to wear a mask if we go out for essential errands, and we need to do social distancing and good hand hygiene and the things we have been talking about. But most importantly, we've got to do what we need to do to make the alternate care facility obsolete again and get back to treating folks primarily in their home communities.
Thank you, Danny. Now to Victoria Seha from WAOW-TV in Wausau. Victoria. WAOW-TV. Okay, we'll move on then to Katie Crother from WTMJ in Milwaukee. Katie?
Hi there. Governor Evers, wanting to know what your level of concern is of COVID spread in Milwaukee County, Dane County, throughout the state, now that large numbers of people will be coming together to possibly conduct recounts.
Well, that's one of the reasons the recount is costing the money. It is costing because both Milwaukee County and Dane County need to bring people together in order to make this recount happen. And in order to do that, it has to be done safely, so that they have to set up protocols. And so, yes, I am concerned about that. But at the end of the day, democracy needs to move forward in this country and the state, and we have an obligation to do a recount. Obviously, my opinion is that it's not going to change the ultimate definition of what this who won or who lost. Former Governor Walker and I both would understand that we don't agree on a lot of things, but we do agree that it is a big hill to climb, and it's a big hill to climb that is causing us to be worried about this. But I'm not saying we should shirk our responsibilities. It's state law. It'll be done well by both Milwaukee County and Madison County, but it's going to take longer, and it's going to cost more because we're bringing people together and in relatively small spaces to do this work.
Thank you, Katie. Now to Nick Bohr from WISN-TV in Milwaukee. Nick. Again, Nick Bohr. Okay, moving on then to J.R. Ross from WIS Politics. J.R.
Sorry about that. My phone wasn't unmuting real quick. Just had a question for the governor. One of the criticisms we hear of the mask mandate is that in practice it's unenforceable. How would you respond to the question, if no one's enforcing it, how does extending it help?
Well, you know, that's a great question, and I'll just tell a quick story. I don't believe they enforce it in Georgia either. I was talking to a friend the other day who was spending time in Georgia taking care of his grandkids, and he lives in Wisconsin. He lives in Milwaukee, and he told me, she said, Tony, everybody in Atlanta, you walk out the door, everybody has a mask on. I live in Milwaukee, and that isn't the case. And so I think we have to ask ourselves that question. Why is it different in the Midwest, or that, yes, would I love to have the ability to compel people to do it? But at the end of the day, I don't. And so what we're asking is people to do it for their neighbors, for their friends, for themselves. And I believe it is making a difference. I believe these orders do make a difference. We see more masking up in workplaces and retail places than before. So I think it makes a difference. Would I love to be able to compel? Yes. But at the end of the day, people need to do what's right. And I think people in Wisconsin are and will respond better, even better in the future.
Thank you. And I believe that was Nick Bohr from WISN. So let's try for J.R. Ross from WIS Politics. J.R.?
Governor, you've obviously lamented that the Supreme Court's taken away some of the powers that you have with the appeals court up in Wausau. In the bill yesterday, however, there were no new mitigation efforts in terms of giving you powers to issue mask mandates or giving you powers to restrict bars and restaurants or restrict public gatherings. Why not include those provisions in the bill, and why not put those through the administrative rules process to try and put some kind of powers back in, some teeth back in the orders that you were trying to issue or want to issue to mitigate the spread of COVID-19?
Yeah, well, I'll answer the last part of your question first about going through the administrative rule process. It's lengthy, and the people that are at the end of that lengthy process, namely the Republican leaders on the joint committee, have said no mitigation. So that stops that in its tracks. So why start going down a 30 or 40-day ordeal to have people say no? So we put this group of pieces of legislation in place for two reasons. One is they're important things that many of them have been passed by the Republicans and the Democrats in the past. Second of all, we want to have some assurance that there is resources available for us to continue contact tracing and testing after the first of the year. So those are the things we're focusing on, trying to get those taken care of now, rather than continuing to fight about something. Frankly, we know that they'll never be passed. Where these I believe can be passed, and also it's important for us to make sure that we have the money for testing and contact tracing after the first of the year.
Thank you, J.R. And I'll go back to some folks who called on earlier that didn't respond, and we'll begin with Eric Gunn from Wisconsin Examiner. Eric, are you there?
Hi, this is Bellany from the Examiner. Governor Evers, and actually a question for the health team there too. Did you like or find promising any of the ideas that Speaker Voss floated yesterday on COVID-19 relief possibilities?
I'm not sure exactly what he floated yesterday. I know he talked a lot about testing, and I guess we agree on that. We've already tested 4 million people, or we've had 4 million tests that we've done in the state of Wisconsin already. We're averaging about 40,000 tests per week, and so yeah, we think testing is important. So we agree 100% on that. So if there's some bill that he has or some suggestions around that, we can certainly look at it. But that can't be the only thing. Testing is not prevention. Prevention is wearing a mask and staying safer at home. So, do I think that there can be common ground around testing? Yes, we've done, as I said, 4 million tests already in the last several months. And so we're happy that the speaker feels that that's important too.
Thank you, Melanie. Now to Lane Kimball from News 3 Now. Lane? Okay, and finally, Victoria Seha from WAOW-TV in Wausau. Victoria. All right. right, then that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.